Yes, a very special good morning to you. It's still the Saturday morning experience, and right about this moment we are in that segment called Your Health, Your World. This is where we talk about all things keeping you healthy and how to live a better and long life. Yes, if you're just tuning in, it's Sparkling 92.3 FM. It's Majesty on the MIC, and we're here where we're going to be talking about you. It's all about you. In this segment, it's all about how to live a healthy lifestyle. It's all about how to make sure that you're healthy to the point where you get to do all the things that you usually do and not have any hindrance and problems. But today, I would ask that all the pregnant lady in Cross River State, you are a pregnant mother, an intending mother, a searching mother, soon to be, please step forward, because what we're going to be talking about today is all about you. We have the doctor in the house, and we're going to be paying attention to something that may or may not have crossed your mind, because maybe it doesn't affect you, or for some reason you think it's not your portion. Remember, I always used to say, it's not me, can be you. So please, it's better that you have enough information and sensitize your mind. Remember, they say prevention is better than cure, but I would say if you have to cure, you have to cure on time. In the studio with me, I have a very beautiful looking doctors. I'm talking about no other person than Dr. Wofai Ubi. Good morning, ma. It's good to have you in the studio. How are you doing? Okay, so the people of Cross River State, we have thought about what to talk about, and there's a lot happening in the world of health. But one of the things that may or may not have caught our attention is concerning understanding what preeclampsia, yes, all these medical terms got a big preeclampsia, yes, what it is. And I've come to understand that there's a lot in it that people do not know about. I know that when you are a pregnant woman going to the hospital, this is one of the things you guys talk about, but let's bring it to the general public so that they have an understanding of it. So if you're just tuning in, remember that you can ask questions. You are allowed to ask questions. Let's talk about it. You have somebody that you want to get information for. This is the perfect time to reach out to somebody, to tune to Sparkling 92.3 FM so that you do not miss this information. Is very, very important. Now, coming down to talk about it with this doctor in the house, because what do Majesty really know? I'm an art student. If you tell me you're feeling headache, it's paracetamol. Every other thing is paracetamol. So let the doctor in the house do this, do us the pleasure of giving us so much information about this. And we're going to talk about it. What exactly, coming down to general knowledge, because it's important that we are able to understand what it is before we go into other areas of it. What exactly is preeclampsia, and how does it differ from the very normal, regular, related things that happen in pregnancy?
Good morning once again. This is of Cross River State. I'm Dr. Wofai from the Department of Obstetrics and Gynaecology, University of Calabar Teaching Hospital. This morning we are here to talk about pre-eclampsia, which is one of the medical complications in pregnancy that affects a lot of women in Cross River State. In fact, generally the whole world. Of recent, we've discovered that we're having more and more of our women, our pregnant women, coming down with preeclampsia, and we've deemed it fit that at least we should have people in town should have a knowledge of what it is. Preeclampsia, basically it's a type of hypertension actually in pregnancy. It's we have other types. Anyway, I think I should start by telling us the other types of hypertension in pregnancy. We have the pregnancy-induced hypertension, which is a hypertension caused by pregnancy itself, without any other manifestation, just the blood pressure being elevated or being raised. There are no other manifestation like end organ damage or protein in your urine and all that. Just only hypertension that can be taken care of. And we have this coming up at any stage of the pregnancy, basically after 20 weeks of gestation. That's for a layman 5 months. Yeah, those that are 5 months pregnant, yes, you can have them. And then we have the other type that we call chronic hypertension. This one occurs in women that are already hypertensive. They are already hypertensive before they become pregnant. These are the ones we classify as chronic hypertensives. And then we have the other classification of chronic hypertensive with superimposed preeclampsia. Superimposed preeclampsia. As I talk about preeclampsia, first, it's actually a progressive multisystemic disease that happens in pregnant women after 20 weeks of gestational age. With proteinuria, there's protein in your urine, or you have end organ damage. The kidney just shuts down, you stop making urine, or you're not making adequate urine. You're making urine in little quantity. Or your liver shuts down, your eyes are red, your liver enzymes are elevated, or even your blood parameters, there are changes that should not be as a pregnant woman. So this is preeclampsia. And then when we have someone who is already hypertensive coming down with these same features, we classify them as chronic hypertensive with superimposed pre-eclampsia.
Okay, thank you very much, Dr. Wofai, for that. It's important. It's very, very obvious now that we do need pregnant women to sit and get engaged in the conversation for today, because this is going to be helpful to you. But just to ask, for clarification's sake, is this only for pregnant women? And if it's for pregnant women, should we say women that have gone through the first trimester, or women that are just pregnant in general?
Yeah, preeclampsia happens only in pregnant women. Ideally, a pregnant woman's blood pressure level should be lower in pregnancy due to the physiological changes and all that. But there are some risks involved that aggravates or makes most pregnant women come down with this preeclampsia. Risk like a first-time mother, someone who is getting pregnant for the first time, the body is not used to most of the hormones, and then the blood pressure hormones to start rising and all that, and this gives rise to either hypertension in pregnancy or preeclampsia. Now, when it starts affecting other organs, then it moves to preeclampsia. Then other risk that could be involved is a family history of hypertension, or someone who is already hypertensive can come down with preeclampsia. Then we have other risks like even age also have a risk role to play, a factor to play. Elderly women from 35 years and above, they are at risk of having this preeclampsia. Of course, we know with aging, our body system tends to change, and hypertension tends to be more with aging. And then someone who is already aging coming down with pregnancy, you are at risk of having preeclampsia. Multiple pregnancies can cause it. Twin gestation or twin pregnancy, triplets, you are at risk of having preeclampsia because of the excess hormones and the stress involved in having twin pregnancy. So this set of women are at risk of having this preeclampsia.
Okay, I'm very sure the moment you said it's just for pregnant women, the men took a very long breath in and breath out. But you're still involved because your wife. You do have to know this because it's important that you may not be somebody that has it, but you also have to look out for your pregnant wife. You need to be able to spot these things. Talking about spotting it, can we say early warning signs that we should take note of? The early warning signs that are very, very visible in pregnant women when it comes to this?
Yes, there are signs. There are early warning signs. And that is why we advocate for early antenatal registration. And most of the signs, most of them actually could be asymptomatic. There are no signs, no symptoms. Most of them come even in labor. We'll pick them from there. Some have visible signs in early pregnancy, mind you, from 20 weeks of gestation. That is when it starts. Most of them come down with headache, severe headache that even paracetamol will not take care of. And you see them treating for malaria and they are not getting relief. Severe headache, some have visual disturbances like being dizzy, blurred vision, they can't see, they are seeing double or having double vision. And other signs, nausea, vomiting, persistent vomiting, even after your first trimester. Of course, when you are pregnant, most of them have this first trimester vomiting, but some persist. After the first trimester, going to the second, the third trimester, they are still vomiting. These are the signs we pick out for. And then some have abdominal pain, especially upper parts of the abdomen. That's the epigastric region. They have abdominal pain. These are all the signs, the telltale signs that we look out for. And these are the signs that women out there need to know, have knowledge about. When you are having severe headache, you rush to anywhere to check your blood pressure and all that.
Okay, but can this affect both mother and child? Or is just mostly the mother because she's the carrier?
It affects both. It affects both the mother and the child. It affects the mother in the sense that we talked about end organ damage. And this preeclampsia has so many complications. it can lead to eclampsia. The woman might just start convulsing. That's what we call seizure.
Oh.
If not taken care of.
Okay, so sorry, doctor. There's a preeclampsia and there's an eclampsia. Eclampsia, meaning that if preeclampsia is not treated properly, it
leads to eclampsia.
Oh, I think we will touch that. We'll just touch that a bit. But before we go further, let's pay attention to management and treatment, because it's important that we are able to manage this situation. So let's just say a woman is being diagnosed with preeclampsia. What treatment options are available? Is there a sustainable treatment option?
Yes, there is. For a woman who is diagnosed with preeclampsia, there are two basic things we need to do. And the first is to prevent the maternal complication, which is eclampsia, which is seizure or convulsion that might come with it. And how do we prevent it? We have medications we use. We've spotted this woman in the clinic or in labor. We have medications we use to help prevent her from having seizure. Using magnesium sulfate. That's one we use common everywhere. That's the common one. Even in healthcare and primary healthcare centers, they know how to give that one. So that's the first thing we do. Try to prevent seizures or convulsion. That's the eclampsia. And then secondly, we look for it to control the blood pressure. There are still medications we use for that. A lot of medications. We have the ones we give through the vein intravenous, and we have the oral medications as well. And then we try to do all this, our aim is to prevent maternal and fetal mortality or morbidity.
Okay. So are there more to this?
Yeah, and of course, depending on the stage or the gestational age the woman presents.
Yes, I was going to ask.
Yes, depending on the time she presents, we might aim at delivery, because to cut this complication short, you have to deliver the woman. The woman has to be delivered. Now, if she comes, let me say, at a gestational age of 34 weeks, that's 7 months, you try to, of course, you have to deliver at any gestational age if your approach to management is not working for her. Because there are people that comes even below this 34 weeks gestational age. The blood pressure, despite everything we've given, the blood pressure is not surrendering. It's still going higher. It's still going higher. The protein in the urine is still increasing. Nothing is changing. You have to deliver that woman. You think of the mother first. You have to save the life of that mother, because there are other damages ongoing. The kidney might just shut down and all that.
Okay, still on this particular question, should it be that situation leads to you delivering this baby before the 9 months? Are there complications that this baby tends to go through? I'm looking at heart complications, maybe size, and other things.
Yeah, there are complications. Imagine bringing out a premature baby. The child will have complications associated with prematurity, like having hypothermia. That's of course, as a child is growing there, the fat, that adipose tissue fat is being increased. That's what helps in regulating their body temperature. And you're bringing out a child that have not developed this. The child tends to have a low temperature that can lead to death of the child if not properly taken care of. And other complications, they can bleed into their brain because the vessels are not well developed. So any little thing, the vessels tend to rupture if care is not taken and the child dies. So these are most of the complications. Some of them might come as being asphyxiated, no enough oxygen, and it leads to death of that child.
Okay, so can preeclampsia be managed at home?
It cannot be managed at home.
Very important.
It has to be managed in the hospital, not at home. You cannot give magnesium sulfate at home. You cannot give antihypertensive at home. Who is going to monitor the blood pressure of the mother? Who is going to be checking the urine of this woman? It's not managed at home.
I asked this because we see most of our people in the rural area that do not have, I will not say do not have access, or maybe very distant access to health care, and they believe in having the traditional midwives. Should it be in this situation, what should they do? And thank God you have clearly stated it out that it cannot be managed at home. So that's very, very important that we put it out there. Remember that you have questions you want to ask the doctor in the house. Do well to send us a text message or call us on the number 0812-723-7060. Yes, we would have to go on a very short break so that when we come back, we'll be able to take text messages. I see some WhatsApp messages popping in, and we'll be able to relate it to the doctor in the house, and she'll be able to put in her answer. I'm still going to tell you that it's still your health, your world, and that's the segment right now on the Saturday morning experience. But before we go, let's take this quick call coming in. Hello. Hello, good morning.
Good morning.
How are you doing? Please tell us your name and where you're calling us from.
My name is Comfort. I'm calling from Majesty.
Okay, Comfort.
Yes.
Okay, so Comfort, what's the question you want to ask? The doctor is listening.
Okay, I wanted to ask the doctor, like, how many months do baby form everything for?
How many months?
Yes, like, how many months, like, before everything, the sense of God and everything like that?
Okay, Comfort, the network is a bit unstable and I really cannot hear you clearly. But I'm hearing a question of how many months. Please, can you say the other ones very audibly?
Like, I mean, like, how many months? Okay, like, if someone wants to go to a scan to check, like, is this a male or a female baby? Like, how would the first, like, how many months the person will go and check?
Okay, so what you're asking is how many months would you be able to tell the gender of a child?
There's the gender.
Okay, thank you very much, Comfort, for that. We're going to relay that question to the doctor, but that would be when we come back from the break. So let's keep that question very pending, and many others that are coming in from WhatsApp, because I'm seeing somebody asking if this could lead to death, if there's a death sentence at the end of it. All those questions will be answered when we come back from the break. Remember, do not go anywhere. Keep mute, keep your radio very close to you. When we come back, it's still going to be your health award. Don't go anywhere.
Calabar's number one. Number one. Music, sport, and talk radio. Let it hit on.
Ladies and gentlemen.
Sparkling 92.3 FM. Sparkling 92.3 FM. Calabar.
Yes, welcome back. You're still tuned to Sparkling 92.3 FM, and we're still in that segment, Your Health, Your World, on the Saturday morning experience. And I still have with me a very beautiful doctor. I'm talking about Dr. Wofai, and she has been telling us a lot. Like, I don't even know. If you're not seated and receiving this information, you're actually missing. So if you have a friend that's a pregnant woman, it's better that you reach out to her right about this moment and tell her to tune to Sparkling 92.3 FM, because there's an information that usually she would pay a lot to get, but she has it right here free of charge, courtesy of Sparkling 92.3 FM. So getting back into the conversation, before we went on the break, we got a call, and this lady was asking at what month would you be able to get the gender of a child. And we also got a text message that was asking about Could this lead to death? Now, let's just first answer this once before we move forward, because from here we're going to be looking at complications and preventions of that nature. But over to you, doctor.
Thank you. The first question is, at what month will you determine?
Yes, would you be able to tell the sex of a child?
The sex of a child. I'll leave that to your radiologist, but from the second trimester.
Okay.
From the second trimester. But visually, to get a real, how to put it, like, to get the accurate gender is from the third trimester. But you can pick it from the second trimester.
Okay, so Comfort, I hope this answers your question. From the third, you can be able to pick from the second, but to get it confirmed, one that would be from the third trimester. Hello.
Okay.
Hello, good morning. Okay, please do call us back, and if you're trying to reach us, you can get us, do well to send a text message. And the second question was asking about death. Can this lead to death?
Of course, it's one of the, in fact, actually the major cause of death after postpartum hemorrhage. When I'm postpartum, women that bleed after delivery, the next is Pre-Eclampsia and Eclampsia. That is the next cause of maternal mortality. That's death of a woman who is either pregnant or had given birth in the first 42 days. That is the second most common cause of death in pregnant women. If not tackled early, like I said, early antenatal registration, we pick this hypertension early, start managing the woman early and till delivery. But if this woman comes late, you've already had your seizure and all that, the chances of surviving, depending on the stage you present, it can actually lead to death. In fact, it leads to death.
Okay, so we did say we're going to touch down on complications and prevention, but before then, I just got this question very fast in my brain. Misconceptions. But before we come down to misconceptions, can lifestyle, and when I mean lifestyle, I'm looking at the activities, I'm looking at eating habits, I'm looking at exercise. Can lifestyle somehow, should I say positively or negatively affect a pregnant woman with preeclampsia?
Yes, lifestyle can affect a pregnant woman, either positively or negatively, depending on the one you're doing. If you are living a positive health lifestyle, your pregnancy will go on well. But when you're living the other side, you're overeating, sedentary lifestyle, fried foods, you're eating junks, and all. Of course, even someone who is not pregnant, eating all these junk foods,
it's not healthy.
Yes, it's not healthy. Taking alcohol and all that increases your risk of having hypertension. Not talk of when you are pregnant. Pregnancy already has its own risk of increasing someone's blood pressure. If you have other risk factors associated with it, then you're not adding sedentary lifestyle, overeating and indulging in junk foods. It will help. It increases the risk.
Okay, so coming down to misconceptions, what are some of those very popular misconceptions that tends to you hear a lot? Because when you're in the hospital, you tend to hear a lot of things. Yeah. People even say, my church doesn't do this, my church will not allow me to do that. And then people come down together with, it's against our belief, it's against this. So what are some of the misconceptions that you've heard that you just need to clear out and let people understand that that's not how it is?
Okay, as Africans, we tend to do more of church. We tend to go to traditional birth attendance. My mom can deliver, my mom's friend and all that. They're the ones, they take delivery, they've been taking delivery and all that. But then you don't know who will come down with this complication of preeclampsia. You don't know who come down with this complication of preeclampsia. So we tend to see most of them coming from the church. And when they are presenting late. You see a woman who is bloated all over, her face is swollen, her hands are swollen, her legs are swollen, and she's taken to the church without proper evaluation from any healthcare professional. The blood pressure is not checked. Nothing is done for you. In fact, most of them even do antenatal. Most of them come from the traditional birth attendants and all that. And then most of them come believing that it's someone is doing me. Let me use that word. someone that did this. Most of them come believing this person is has a marine spirit and ogbanje. That's why she's having convulsion in pregnancy.
Yeah.
Meanwhile, remember, all through this person's life, this person has not had, there has not been any episode of convulsion, no seizure. And all of a sudden, the person is pregnant, going towards term or towards the right. Person has convulsion. You now tag that person as being an Ogbanje. So this is all the misconception we need to clear. It is not an Ogbanje. It's a complication of that pregnancy. And it's naturally not the woman's fault. It's her hormones. It's not her fault. And this tends to, another thing, it tends to be more common in women who had a second husband as well. You've had a first husband, you've given birth for that man. You've now remarried, your husband died, or somehow you're separated from the first husband. You're having a second husband, and you're at risk of having this preeclampsia because there's this discommunication. There's something about the sperms not being tallying. You've been with this man for long. You're used to his body system, his body secretions, and you're going to a new man, a new husband. That's what we call new consult, a new husband. So everything changes. It takes you back to being a first-time mother for this man, or like if someone who is a first-time mother being pregnant for the first time, everything changes. So this misconception of is from here, no, it shouldn't be there. It's a pregnancy complication. It's a pregnancy complication.
Okay. Thank you very much, Dr. Wofai. So, funny enough, I can't even say for people outside, but I myself inside am beginning to learn a lot. You did mention about having the first husband and the second husband. Don't have two husbands. But that's just on a lighter note. Don't have two husbands. Have only one. Okay, so coming down to complications and preventions, looking at possible complications if preeclampsia is left untreated, what are some of those things? Yes, you did mention a lot about it could result to death. For some situation, but let's before we get to the higher part, let's look at the ones that can be handled. What are some of the complications that can be handled in the hospital that can arise when having preeclampsia?
Okay. Like I said earlier, one of the commonest complications of preeclampsia is eclampsia. That's the seizure part. That one can be handled if the woman presents, even if the woman presents with seizure. Most of them come unconscious, and we still give her medications and they come out of it. Those ones can be handled. And then another complication that can be handled is the acute renal injury, acute kidney injury. The kidney just shuts down and starts producing little quantity of urine or no urine at all. It can be handled in the hospital, depending on the stage of damage of the kidney. It can be handled even up to dialysis level. It can be handled. Another complication is the blood. That's what we call disseminated intravascular coagulopathy. The blood parameters, especially the platelet level, just drops. And you see most of them bleeding from different sides. And that one too can be handled in the hospital. It's not something that can be handled outside the hospital. When I'm saying the hospital, a tertiary hospital, like the teaching hospital, it's not the healthcare center. A tertiary hospital where they have other physicians, they have other specialists, because this condition is multidisciplinary. It invites other aspects of medical care in the management of this woman, like the physiologists, the physicians, the cardiologists. They have to be part of the management of this woman. The hematologists that are involved in blood, especially a woman who has come down with this disseminated intravascular coagulopathy, where the woman is bleeding from every side, her ear, her nose. Even when you try to put a cannula from puncture site, they have to be there, because at that stage, this woman, all the woman needs is fresh whole blood. Give her fresh whole blood that has a full coagulating factor, complete coagulating factor, or give her platelet concentrate that can help in stopping this from progressing. Because if he's not taking care of, the man can die. That leads to death. And another complication is blindness. Most of them come, they are not seeing. So at that point, the eye people have to be involved. The ophthalmologists too have to be involved. And this is why this is why this man have to be in the hospital. It's hospital management. The eye people have to be involved. But for the blindness, once the woman is being delivered, the blood pressure starts coming down, everything starts, her size comes back too.
Okay, that was it was important that you added that.
It's not a permanent blindness.
Okay, very important that you added that part, because I was beginning to blindness. Oh my god.
And another common complication is what we call abruption placenta. That's separation of the placenta because of the high blood pressure. The placenta cannot hold it anymore. It separates, and that will lead to the fetus or the baby dying. At that point, it can also be handled in the hospital. Once we notice it, early delivery of that baby, the baby is still alive. It's good for the woman. She goes home with her baby. But when you come later and it has already happened, the baby is dead. That's another part of it.
Okay, there's actually a lot.
There are lots of complications. A lot of complications. These are the common ones.
And you see, the funny thing is that people do not. I think we need to. I'm not saying no issue is small or no issue is bigger than the other, but I think we need to step out from the very regular awareness that we do create. Like, I know the cancer awareness, the HIV awareness. Maybe we need to start digging deeper into some things, some very major things that are happening. Take for example this this eclampsia. Say we do not have this conversation, most people will not get this information, and when there's no information, there's no knowledge, there's no way people can assess a lot of things. So thank you very much, Dr. Wofai, for actually taking our time to come talk to us. But we're not done talking, because there's a lot we need to cover when it comes to this. Looking at post-pregnancy concern now, there's one that I want to talk about, and it's the postpartum. You did say that it draws down to many other areas, many other doctors, specialists coming in from different areas. Do we get somebody for postpartum? Because, having your body go through all those things like that and looking at your baby, and I'm like, it's because of this child that I have to go through. Is there a sort of like a psychological effect that this can have on the mother towards the child, down to the part of having postpartum depression and all?
Yes, it does. I remember this woman had gone through a lot, from pregnancy to delivery of that child, and even the normal someone whose pregnancy moves on normal to delivery, most of them still come down with body changes that affect them psychologically. Not talk of one that have gone through extra work. Yes, extra work of hypertension, proteinuria, having cesarean section for most of them that we want to do cesarean sections for, that didn't plan for it. And then it's on the whole stress. Those that will come down with 17 intravascular coagulopathy, most of them will give them a lot of blood, up to 5, 6, 7, 8 units of blood. And then one will just looking at the child. So is this child that gives so this, most of them, when we notice any telltale sign of this patient is going to have postpartum blues, postpartum depression and all that, we invite the psychologist or the psychiatrist. They come around to talk to these women, try to talk them out of it. It's not their fault, it's not the baby's fault, it's just pregnancy. And I've had most women who say, after this pregnancy, I'm not going back, or I'm not doing pregnancy again. No, it's not that if you've had it in this first pregnancy, it's a guarantee that subsequent pregnancy you're going to have it.
Okay.
It's not going to be there. So we have to also talk them out of that.
Okay, and still on that particular issue, coming down to talk about the heart health. Let's extend down to the heart health. Can preeclampsia affect a woman's heart health in the long run? Not even talking about current now. We're looking at futuristically. Is there an effect it tends to have on her?
Yeah, concerning heart health, yes, it does, but it's common with those who are already hypertensive before pregnancy that then comes down with preeclampsia. But for someone who just comes down with preeclampsia, the percentage is very low. But it can in future pregnancy. And mind you, most of them too, having come down with preeclampsia, postpartum period, we have to monitor them for the first 12 weeks after delivery, because most of them might migrate from preeclampsia to having chronic hypertension. They become hypertensive for life. Some resolves after delivery, some don't resolve. And these patients, and the ones that don't resolve, basically, if you go deep into it, you discover that they actually have the risk of, especially family history of hypertension. So most of them don't resolve. They progress into being hypertensive. And that's, of course, hypertension has to do with the heart. So it's...
Okay, yes, just to tune to Sparkly 92.3 FM. And we have been talking about, it's the preeclampsia, pardon me please, and that has to do with a pregnant woman, and it's been a lot. I don't know how some people do pull it together, and you see, stepping away from this conversation, this is just for personal knowledge. We find out that during pregnancy a lot changes, including the the size of the hands, the leg, the nose. There's just a lot of change that goes from a before and after. What can we say tends to be because of that? Is it just very regular? Because I still see some other people slay during pregnancy, looking the best, they are glowing. Could it be like a body thing? Is it a body thing, or maybe it's just, please help me.
There is what we call constitutional. Those ones are, it's just there. You're slim, you're pregnant, you're still slim. You're slim, you're pregnant, you're adding weight. So it's more like constitutional. It's not, and most of them too has to do with the hormones. Depending on how your body take the hormone, especially the progesterone hormone, tend to increase our fats in the body, because to be obese, our nose will be big, our hands are big, and all that. So it has to do with the hormones as well. And there are some people that most people during an early stage of pregnancy, they have this early vomiting, they don't eat, they lose appetite. So all that ones also contributes. They don't add weight. They don't really add weight, like those that have good appetites, that craves for things, everything they see they want to eat, and all that. So it also contributes to.
Still asking very personal questions, and I'm asking personal, but I'm sure there are a lot of people that want to ask this. It's the whole concept of how you feel during menstruation equates how you feel during pregnancy. Is it true?
How you feel during menstruation? I don't think so.
Okay, because most people will say, "Oh, this one that I'm having like painful menstruation, I'm having cramps.
Okay.
It's very possible that when I'm pregnant, I'm also going to have painful delivery."
Labor is painful. So you're having painful menstruation. When you come in labor is painful. So it depends on your pain threshold anyway. Okay. If you're a type that can bear pain, you can come in labor and you're quiet. If you cannot bear pain, you scream the whole. Labor is painful. It's a painful thing.
Okay, coming back to the conversation we're having now. Yes, we'll take your calls. We'll take your text messages. You have a question you want to ask the doctor in the house. You are a woman and something bothers you when it comes to pregnancy, a pregnant woman or a woman that's expecting. Please do well to put out your questions by calling us on the number 0812-723-7060 or 0809-230-0022. Now, coming down to general advice. Well said from the beginning of the program till the end. We've actually talked about a lot, and I just want to know, as a doctor, very well trained in this line of, what would you say is your advice? What should a pregnant woman do if she notices symptoms of this preeclampsia? What's the support available for women dealing with it? And what advice would you just give a pregnant woman listening to us right now, or an expectant mother, somebody that intends to be pregnant? What advice would you give in keeping a healthy lifestyle? Say yes.
Okay. I will start with the last question, advice given to a pregnant woman. First, we should start by registering for antenatal early, before 20 weeks gestational age. Ideally, you're supposed to register once you're 8 weeks pregnant, that's 2 months pregnant. You're supposed to register for antenatal care. At that point, to do your first scan to help us to accurately date your pregnancy, and then subsequent ultrasound scan that will help us further to monitor the growth of your child. And registering early too will help us pick out the signs early, because you might be walking around without even knowing you have preeclampsia or you have hypertension in pregnancy. That will also help us to pick out the signs early. Each time you come for your antenatal visits, your blood pressure is being checked, your urine is also being checked, and then your past volume is also being checked. So it helps us to know women that need extra care. And when you register early, you come, the doctors ask you questions in your first antenatal visit with the doctor. First time you're interacting with the doctor, we ask you questions across, even up to your family. even up to your family. These are ways we pick out those who have family history of hypertension, that we know that this one we need to pay close attention to them. And then people that are at risk of having this preeclampsia, we need to pick out we need to make close attention to them. And that said, early antenatal registration, and then actually when we pick out most of these signs, we tend to prevent. There are medications we use to prevent preeclampsia, like a woman who have had preeclampsia before, or a woman who is hypertensive, a woman who has family history of hypertension, a woman who has history of diabetes mellitus, a woman who is above 35 or who is up to 35 and above. We place them on low dose aspirin. That will help to prevent them from coming down with preeclampsia. And this is started at after the first trimester, from 12 weeks up to 36 weeks, or before your delivery. That will help to prevent. Another supplement we can give, or we give, is calcium. This also helps to prevent preeclampsia. So imagine if you're not registering early and these things are lost along the way, you come down with preeclampsia. So my advice to pregnant women, or those who are intending to be pregnant, or husbands and brothers who have sisters that are pregnant, we encourage early antenatal registration. And please register in the hospital, even if you don't have the government's the tertiary hospital close to you. At least we have the general hospital. We have a very functional general hospital here in Cross River State. Across the state, we have general hospitals that are functioning. We have primary health care centers that are very well functional. They know when to refer a pregnant woman who is coming down with preeclampsia. They don't manage in the primary health center. They refer to the tertiary hospital. So early antenatal registration is the key to managing these women. To every pregnant woman, irrespective of whether you're down with preeclampsia or not, it helps. And then there's also this misconception of I've given birth 2-3 times, I'm fine and all that. Mind you, I early say that one of the risk factors is multi-deliveries, multi-parity. The woman who have had like 2, 3, 4, 5 babies, you are at risk of having preeclampsia. So you have to register early. So these are some of the preventive measures we take. And that's it. So women should learn how to take care of their health.
Yes, be very, very, very careful. Eat right and
eat rightly and
live
take
very good lifestyle.
Yes.
Thank you very much, Dr. Wofai, for taking our time to be here to sensitize us and give us proper awareness on this. And to you, my very esteemed listeners, you always are my number one. That's why I go through extra length to make sure that I bring as much information as I can to you. But remember that you join us next Saturday, same time, same station, for another fresh edition of Your Health, Your World. But for today, thank you very much. Thank you, Dr. Wofai. Sit back, relax, enjoy. It's still Saturday morning experience.